Alarming claims. The Biden administration accused of covering up a congressionally mandated report on the earliest suspected American COVID cases. The Washington Free Beacon says the report reveals 7 Americans may have contracted COVID-19 in Wuhan in October 2019. Free Beacon journalist behind the bombshell report is Andrew Kerr, and he is with us now. This is one of the things that you say, call for number 1 here, that the revelation adds to a mounting body of evidence that the virus was circulating in Wuhan for months before China disclosed it to the world in December of 2019, and further bolsters the growing consensus that it could have leaked into the human population from a Chinese lab. I think a lot of people might be able to understand that. The more interesting thing could be for our audience, who asked for the report and who didn't basically release the report more widely?
Right. So this report showing that we had a military delegation that competed in the World Military Games in Wuhan in October of 2019, and 7 of those members came down with COVID-19-like symptoms, according to this report. Now, it should have been released to the public way back in 2022. Congress required the Biden administration through the 2022 National Defense Authorization Act to do this report into potential COVID links to these military games in Wuhan in October 2019. And the Biden administration just didn't release it to the public. The Trump administration, sometime in late March, quietly released it. And here we are now. So it's bombshell information. It just adds to a growing list of evidence, reported by the Wall Street Journals and others, that COVID was likely circulating in Wuhan months before the known start of the pandemic in December 2019. And it's just another blow against the initial theory that was propagated by the scientific community that this thing could have leaked into the population through some wet market. But no, now it's just another piece of evidence that it indicates that no, the bat coronavirus research lab, the Wuhan Institute of Virology, that just so happened to be a few miles away from these games where these service members got sick, more likely that is the cause of this virus.
Let me take you in the Wayback Machine to June of 2021. And Josh Rogan did an investigation, and he wrote this. Pentagon spokesperson John Kirby told me that the Defense Department has no knowledge of COVID-19 infection among U.S. troops participating in the 2019 World Military Games. He said that there's no evidence U.S. military personnel were infected before travel restrictions the U.S. government implemented in early 2020. Do you think he didn't know, or was told something that was not true, or what?
That's a great question. What we do know now is that was not true. Whether he was intentionally misleading the public or if he just didn't know himself, we don't know. But yeah, no, we had 7 service members that contracted COVID-like illnesses. Ooh. And what's remarkable about this report is that the military did nothing about it. They never tested these service members after the fact for COVID-19 antibodies.
We need the names of these 7 service members. I need them to come out to the public and say, yes, I was one of the service members that did contract early on symptoms of the COVID-19 virus. Like, okay, you guys are reporting this news of what happened years ago. We need more clarity, more evidence for this claim.
They never conducted an
I don't believe it right now.
Investigation into whether there's any sort of link between our guys getting sick over in Wuhan 2 months before the pandemic and the outbreak of the pandemic, and they never even bothered informing our allies. There were military athletes that participated in these games from Italy, Luxembourg, Germany that reported very early on the pandemic that, we got really sick with COVID-19-like symptoms when we attended those games. And our military knew about these illnesses from our guys, and they didn't even bother informing our allies. It's really quite remarkable.
Do you think it would be beneficial if Secretary Pete Hegseth asked them to come in and talk to him about it?
Absolutely. The New York Post reported yesterday that the House Republicans are gearing up to do another investigation into COVID origins. They want to bring back Dr. Fauci for questioning. So, absolutely. I think this is something that that the military should clarify. Why didn't you release this report? Why is it years late in releasing it to the public? And why didn't you do anything about this bombshell information?
And he said October 2019, and that was still under the Trump administration. But because that was towards the end of his term, that could have been overlooked. There was a billion things going on. COVID was just coming out. Everybody didn't know nobody knew what the hell to do. Nobody knew. I mean, even our own government, even Dr. Fauci, nobody knew what to do. They made up, oh, you got to wear masks, and let's stand. Let's pick a number 6 feet away from each other, and yeah, we should be good. But try to stay home, and maybe we shouldn't go to work either. Let's stay home. Nobody knew what the hell was going on, but I remember during the outbreak, initially within January, February, March, the first couple of months of it, I remember hearing about either a scientist or somebody that was there in Wuhan who was trying to let people know that there was an outbreak about to happen. Like it somehow he had the answers of what it was going to be released, and all of a sudden he gets killed in a car accident or something wild. He gets killed. Either he gets killed or he gets murdered. I don't know. I want to pull him up real quick and see if I can find him. Okay, so I believe this is the gentleman. So Li Wing, I can't pronounce his name, but he was a Chinese, I don't even know how to say this shit, who warned his colleagues about early COVID-19 infections in Wuhan. Look when he died, very early on. December 30th, 2019, Wuhan Centers for Disease Prevention and Control, Wuhan CDC, issued emergency warnings to local hospitals about a number of mysterious pneumonia cases discovered in the city in the previous week. On the same day, Li, who worked at the Central Hospital of Wuhan, received an internal diagnostic report of a suspected severe acute respiratory syndrome, SARS, patient from other doctors, which he in turn shared with his Wuhan University alumni through a WeChat group. 34 years old. They're saying his cause of death was COVID-19. He was dubbed a whistleblower when that shared report later circulated publicly, despite his messaging to his alumni group not spread the message outside of the group, with the exception to only remind their family members and loved ones to be on the alert. He did not appear to have intentions of warning the wider public. Why? Rumors of a deadly SARS outbreak spread on Chinese social media platforms. Wuhan police summoned and admonished him and 7 other doctors. Wait, what? Admonished? 7 other doctors on a excuse me on January 3rd for making false comments on the internet about unconfirmed SARS outbreak. See, they were already freaking telling him, hey, you're saying things that you shouldn't have, when he was actually in the right. The outbreak was later confirmed not to be SARS, but rather a new coronavirus. I mean, this SARS is bad in itself. I mean, he should have spread it as it was SARS to make people more extra cautious. He returned to work and later contracted COVID-19, the disease caused by the virus, from a patient who was not known to be infected. He died from the disease on February 7th. See, I heard he got... The police apologized to his family and revoked his administration on 19 March. He was awarded the May 4th Medal of the Government. They all freaking died. I could have sworn he got killed in a car accident. I was wrong, I guess. Man, see, this is why I wish I was doing YouTube during this time, because the information that was coming out like quickly, the reports were direct reports, and now it's come to the point where we don't know what the hell exactly happened.